can finally see the glimmer of hope at the long, dark medical tunnel. You're at the last stage of the medical process, the last hurdle, the final boss, if you will, to overcome, to finally fulfill your long-term ambition of getting into medical school. And to raise the stakes slightly higher, this is the only step that's in your complete control. You decide the outcome, so no pressure. But I did, on 2 different occasions, 4 years apart. After thorough reflection, I've come up with a list of interview tips that I wish I had used on both occasions, and I want you to use right now to make the whole process a lot easier and hopefully, if it's even possible, more enjoyable. So let's crack on. I had 2 opportunities to get into medicine, the one in 2014 and the second one in 2018. Although I did manage to get into medicine eventually, it was definitely not a smooth sailing journey. My first set of interviews in 2014 was a complete disaster. I didn't have any guidance or any help on how to prepare for them, and I got rejected within 2 weeks. I mean, I think reading a biology textbook isn't the most effective way. And my second opportunity to get into medicine came 4 years later, in 2018. Now, you would think I learned from my mistakes 4 years ago. You would think that I did everything in my power to not let history repeat itself, but I did. My first interview in 2018, the Warwick one, was a complete failure. I got rejected again within 2 weeks. And so I had flashbacks of 2014. I can't let the whole thing play out all over again 4 years down the line. I needed to know what went wrong, why I wasn't able to perform like I did in the mock interviews while I was preparing for the interviews. And I only had 10 days to figure this out. 10 days until my King's interview. Luckily, it didn't take me long to realize my mistake. And I did so on the car ride back to London. And the answer was quite simple. I just wasn't prepared enough for the second time in a row. Luckily enough for me, 10 days was enough to right my wrongs. And I went to both the King's interview and the Southampton one a completely different person. So this transpired from getting 1 rejection out of 1 to 2 offers out of 3. So what changed? What did I do in those 10 days? And this is what this video is going to be all about. It's going to talk about why I didn't perform well in the first Warwick interview, what I did in those 10 days leading up to the King's and Southampton interviews, and the things that I wish I'd done from the get-go. So let's go. Now, at the time, I thought my preparation was pretty adequate, but now, in retrospect, it clearly wasn't enough. The first mistake I did was to start preparing for the interview after I got the interview offer, which is completely wrong. You should ideally start preparing for the interview thinking that you're going to get the offer anyway. I read the news, all the NHS hot topics at the time, like the Charlie Gard case and etc., and religiously visited BBC Health. I even read some BMJ articles to prepare for any potential questions about recent scientific developments. I even compiled a list of the most frequently asked questions on interview day that I gathered from various sources, from talking to ex-medical students at the university and even foraging through the student room, which is a student forum that holds really good discussions about previous interviews. But what I didn't do was actually answer the question. Now, I'm not expecting you guys to write an essay when it comes to answering why medicine or why would you become a good doctor, stuff like that. But had bullet point would be so much helpful, so much helpful. My girlfriend at the time came down from Boston and we only got to see each other once a year, and I literally just wanted to spend all the time with her and I barely prepared. Apart from those little things, I probably allocated 30 minutes of my day to all the things that I previously mentioned, but I only had myself to blame. I should have allocated my time a bit more reasonably. Should have woken up earlier and spent at least 2 hours a day trying to prepare for the Warwick interview. But I didn't, and I faced the consequences. And this is the biggest mistake that I see aspiring medical students repeat time and time again, is thinking the more you prepare, the more robotic that you'd sound on interview day. So I YOLO'd it and thought unprepared answers off the dome would sound the most authentic and the most natural as well, which clearly wasn't the case. I didn't know how to answer half the questions that had been asked in the Warwick interview. I choked. And I got a bit too complacent from the feedback that I received while I went to the mock interview stations, and I sort of let that get to me, not knowing that the interview day is actually so much more different to mock interviews. Although you're really good at mock interviews, you never know how you're going to perform on the real day. And that's what happened to me in the Warwick interview. It was such a shock, basically. And what threw me completely off the boat was I did not know that the interviewers at some universities are trained not to express any emotion, are trained not to show any sort of non-verbal communication. So all the mock interviews that I attended, whenever I was answering well, the interviewer would either nod their head or smile, and this sort of gives you the idea that you're doing well, and it actually motivates you to keep going. But the moment I realized in the first station in the Warwick interview that the person sitting in front of me, the interviewer, was the most stoic person I've ever met in my life. Like, they were just sitting there staring at me, and that immediately gave me an impression that I was already doing a really bad job at answering questions. And that really knocked my confidence down, and I wasn't able to recompose myself in the next station. And so when the final bell rang, I immediately knew I was going to get rejected, and I mentally prepared for that as well. And like I said, on the car ride back, I immediately realized my mistake. Now I know exactly what to expect, and I felt like it was sort of like a blessing in disguise, because in the 10 days that I had for the next interview, which was the King's one, I completely changed the way I prepared for an interview. I made a document of all the FAQs that I collected from my previous preparation. Now, what I did differently this time is I actually answered these questions. I made bulleted points and definitely not a script. So that's where I'd like to differentiate or draw the line between preparing for questions. Is the more you script an answer, the more tempted you are, the more inclined you are to intuitively learn it by heart because you think that's the perfect answer. And you put pressure on yourself to memorize the whole thing word by word. And when it comes to the interview day, if by any chance you forget a sentence, it just completely throws you off. So having a bulleted point is basically how I'm making this video. I don't have a script, I just literally have bullet points and I elaborate on them essentially. So bulleted points are good, it does make you sound natural and not robotic, trust me. And quite a cliche but general tip on how to answer the question is answer to the point, don't go off on a tangent. So after you wrote up your answers to the question, just have a read through and just think to yourself, am I really answering the questions? Am I really hitting the nail on the head? Some of the FAQs that I've managed to compile is why medicine, your biggest strengths and weaknesses, why this university, which is a really important question, and I'm planning on making a video on that because I think personally that's where I really stood out from the rest of the competition, because I really researched on the university, and the bigger you boost their ego, the better essentially. Another question is how do you cope with stress? So this is where you really talk about your hobbies and try to make them sound interesting. And what will make you a good doctor? Which is probably one of the most important questions, especially in panel interviews. So the structure I use to bullet point my questions is using the STAR method or the STAR framework. It's basically the situation, the task, the action, the result, and most importantly, the reflection. So when you're talking about quality of a good doctor, you first talk about the setting, where you were at. Then the task is essentially what you did or what you had to do. The action is how you did it, and the result is what transpired. What was the outcome? Was it successful? Was it not successful? And reflection. And reflection is really important because even in the unsuccessful outcomes, reflection is your chance for you to spin that negative into a positive. So reflection is basically what you've learnt from that experience, what you've learnt about yourself, how that would relate to medicine, which is the most important thing, and what you could do better the next time it happens again. And this is where I talked about spinning a negative into a positive. And make sure your answer's about 1 minute, maybe 2 minutes max, because you want to give enough time for any leading questions. The next tip is practice your answers out loud. Get someone to critique the way you speak, or even better, record yourself talking like I'm doing now. So after I started practicing by myself, by recording, by critiquing the way I speak, my non-verbal communication, I graduated to a real life person. And the more distant this person is, the better. There's no point going to your mom because she's your biggest fan. So even if you choke completely saying 2 words, she's still going to think it's a really good answer. So personally, there's no point. So who I managed to get to critique my answer was my careers advisor, who I managed to keep in touch after graduating from Cardiff Uni, quite a distant family friend who's a GP, and I was so grateful. But I met the specialist registrar in orthopedics at Barnet Hospital, and he sat on advisory panels for university hospitals. He wrote an Amazon bestseller about medicine, and he also founded an education startup. So I personally felt there was no better person to get to critique your answer and even give you a mock interview. And that was really great because he literally went to town on giving me tips on how to improve, and I was so grateful for it. And that's another point. You kind of want to ask a person who you know is going to be a bit mean when it comes to critiquing someone. And talking to a real life person adds that little bit of pressure. It adds to that anxiety inducing atmosphere because you want to impress the person sitting in front of you. And that essentially mirrors the real interview day. So that's why I also mean the more distant the person is, the better, because 99.9% of the time, the person who's interviewing you is a complete stranger. And I got great feedback. The first one being, I kept umming and ahhing when I'm answering a question. I kept swaying on my chair left and right. I was shaking my leg. But yeah, I've definitely worked on those to the point where I just rarely make those mistakes anymore. I also got good feedback on the things that I need to keep the same, such as good non-verbal communication skills. I was making good eye contact, I was nodding my head. Basically, chuck away the mistakes you're making and keep the good habits. And like I said, take the criticism on the chin. Don't be offended and don't try to defend yourself. And now, 10 days later, came the King's interview. So what did I do before the interview, on interview day? So I rocked up 2 hours early and I just tried to make small chat with all the applicants. This gets your tongue going. That sounds a bit mad. But it just helps with the nerves. Now, during the interview, any question that I found to have baffled me a bit, this time I didn't freeze up. I paused. And I even actually asked the interviewer if I can have some time to think about an answer after acknowledging the question. And this actually makes it sound really good. You come up as a really calm and collected person. And the biggest mistake that I've made in my first interview is don't waffle and go off on a tangent just to fill the silence. Not every silence is awkward, so there you go. But obviously don't acknowledge a question and say, that's a really good question, to something like why medicine, because that's not going to look good. And another thing when it comes to going to the university early and talking to people is that if you ever do get a why medicine question, you can always chuck this in there by saying, I've spoken to the student reps for the interview day at the university and I asked them what this university is like and they told me a lot of good things about the university, and just verbally regurgitate everything that you found out about it. So that's going to look really good in the interview stage, and that's what I did, especially in my Southampton interview, as where I was lucky enough to basically interview the medical students there. This is a cliche tip, is enjoy the interview. Don't treat it like an interrogation, treat it more like a conversation. And the more relaxed you feel about this whole thing, the better it is for you. And after the Warwick one, I was prepared for the mundane stoic expressions. I should have started preparing for an interview as soon as I submitted my UCAS application. It's also why I'm releasing this video at this time, because UCAS application is probably around the second week of October. And so yeah, just start preparing before you even submit it. And another thing I should have done was, if you ever do get a chance to go to mock MMI circuits arranged by like reputable interview companies like Medic Portal and etc. Medical Portal sponsor me. But anyway, just going to those reputable companies, it's all good and well attending the interview circuits and coming back home empty-handed. But to really make the most bang for your buck, because it is quite expensive, is that I should have formed a little group with the people attending those interviews so that you can practice interview skills and questioning and answering people even after the MMI circuits have ended, maybe on Skype or actually meeting up in person at least once or twice a week. This really helps you practice with, you know, people that you don't know really well. So that's a really good thing. And this is a really good tip that I thought about afterwards, is that I should have used Anki to memorize the bulleted points for each question that I've written down. And this really helps you to memorize the bulleted point, because Anki uses a spaced repetition algorithm that will ask you the questions at certain times where it really helps you to memorize them. And knowing about Anki would really set you apart from the rest of the competition, because most people find out about Anki once they get into medical school in the first or second years. So knowing about it before you even start medicine would really be advantageous. If I only knew about it back then. Okay guys, that's it for the video. I hope you found some good pointers from this, and I really hope that you do manage to integrate some practices when it comes to preparing for the interview. And it's definitely worth using Anki to prep for your interviews. If you want me to release an Anki video on the perfect settings to have to really nail the facts or the information, just let me know in the comments down below. So yeah, I made this video because I would have loved a video like this when I was preparing for my interview. So yeah, I just hope you guys find some value out of it. So don't worry, you've got so much time if you're watching this video now. And yeah, just take it bit by bit. Don't spend 6 hours a day trying to prepare for the interview a week before. Just break it up into little chunks and just chip at it day by day. Maybe allocate an hour or two to prepare the answers for the questions that you've allocated to yourself. That's basically it really. And also, know your personal statement inside out. I'll tag my previous video talking about my personal statement tip if you guys want to check that out as well. So yeah, good luck guys, and I'll see you soon.